Sexual Assault Evidence Kit Collection. Why collect a sexual assault evidence kit? The collection of a sexual assault evidence kit is used to document the collection of physical evidence that may assist in the investigation of a sexual assault. Physical evidence includes the documentation of any injuries and tenderness, as well as the collection of forensic specimens such as swabs, urine, blood, and clothing. Locard's exchange principle states that every contact leaves a trace. With respect to a sexual assault examination, this includes evidence that may be collected from the victim, the suspect, and the crime scene. The sexual assault kit is the collection of physical evidence from the victim. The collection of samples from the victim of a sexual assault enables us to look for body fluids such as blood, semen, and saliva that may be transferred from the suspect during the sexual assault. A sexual assault evidence kit is comprised of a box or boxes that contain all of the forms and items needed to document injuries and collect relevant forensic specimens in a standardized fashion. The sexual assault evidence kit is comprised of a core kit and auxiliary pack, and is used to document the collection of physical evidence that may assist in the investigation of a sexual assault. Core kit, the smaller box on the left, and an auxiliary pack, the larger box on the right-hand side. Each of these kits contain a series of envelopes that are going to be used in the collection of forensic evidence. The core kit contains all of the paperwork and collection items that are frequently used and is identified by a unique sexual assault evidence kit number in the top right-hand corner. It is used for one patient only. The seal is broken on the core kit at the time that examination is about to commence. The kit should not be left unattended after this point in time to ensure the continuity of all evidence. The kit contains hospital paperwork, which will be discussed in greater detail, as well as envelopes for each of the steps that are detailed for the collection of evidence. Swabs are contained within one envelope, as well as swab boxes that permit the collection of steps 2, 4, 7, 8, and 9. This kit also contains numbered stickers that can be used for various items of evidence, as well as white stickers to secure swab boxes, item labels for each of the steps. Each of these have the kit number included as well. There is also additional seals for sealing the box once the evidence has been collected and placed inside. Brown paper bags are also found within the core kit. The core kit has a unique sexual assault evidence kit number. One core kit is used per patient. It is a small, streamlined collection kit that is used for every examination and contains items frequently used. All the kit documents, stickers, and seals required are found within the core kit. All room temperature items will go back into the core kit box upon completion. The auxiliary pack contains items that are less frequently used and is designed to supplement multiple examinations. As such, it has a log on the outside that is meant to be completed each time the seal is broken. When collection of items from the auxiliary pack are required, the examiner breaks the seal to the auxiliary pack and removes the items required for the examination using clean gloves. There are seals provided to reseal the auxiliary pack. Items contained within the auxiliary pack include Step 3, the fingernail samples, additional swabs can also be found in the auxiliary pack. There's an additional Step 5 envelope for the blood sample, as well as envelopes containing materials required for collection of parts of Step 6. Additionally, the auxiliary pack contains a large drying pouch, or a breathable evidence bag. This breathable evidence bag is large and can be used to contain one large clothing item, or multiple brown paper bags may be placed within it to contain all of the clothing collected. The auxiliary pack also contains additional brown paper bags in 2 different sizes to permit the collection of additional clothing items if required. The auxiliary pack is the larger of two boxes and contains items that are used less frequently. It is meant to supplement multiple examinations. If items are required, break the seal, remove the relevant items, record the access on the log on the top of the kit, and reseal. Gather the supplies required to collect the kit. This will include the core kit and auxiliary pack if available, personal protective equipment, clipboard and pen, a camera and rulers. It is recognized that some locations may not have access to a camera, medicine cup, sterile water, suture kit, and tape. The supplies required are shown here. A box of gloves should be readily available as gloves will need to be changed between each step and any time they may become contaminated. A mask should be worn to protect both the patient and the nurse. A suture kit can be used for sterile scissors as well as sterile gauze if these are required for any of the steps. This might include step 3, fingernail clippings, or step 6 if it's necessary to clip pubic hair. A medicine cup and sterile water will be used throughout the examination process in the collection of skin swabs to moisten the swabs in advance of collection. A clipboard should be used to take notes and firm pressure applied using a pen. A camera can be used to document any injuries. Any photographs should be taken with the use of a ruler. Tape may also be required as it can be used to seal evidence packaging. The collection is based on the following: history of the assault, what happened, the time frame, meaning the number of hours or days between the assault and the collection of the kit, and whether or not the victim has showered or bathed. This may remove deposits from the skin. Only gather the information required to guide evidence collection and medical care. Do not ask the patient for a detailed statement of the assault. This detailed statement may be collected by the police if and when they become involved. The required information may include the following: the time of the assault, the location where it occurred, the patient's ability to recall events, whether or not a struggle or scratching has been reported, was there any penetration and where, kissing, licking, and biting, specifically where, any strangulation reported, the presence of pain or injury. The collection of this information will be guided by the kit paperwork and the hospital instructions. The time frame for which samples can be collected is largely dependent on how long semen is expected to be retained in the various orifices. Semen can be retained in the vaginal cavity for up to 7 days based on the scientific literature. DNA testing is very sensitive and may detect DNA from semen for up to 12 days. Within the mouth, the maximum time that semen may be expected to be retained is up to 1 day. Here, there are natural processes that are going to remove semen and DNA from the mouth, and these may include spitting, swallowing, eating, drinking, and brushing teeth. All of these activities mean that the lifespan of semen within the mouth is much shorter. With respect to the anus and rectum, the maximum time frame for semen retention is approximately 3 days. Activities such as defecation would be expected to remove semen from this location. Please note that these are maximum time frames and there is a progressive loss of evidence with time. It's important, therefore, that the kit be collected as soon as possible. In summary, here is a diagram that helps with the time frame for the collection of evidence. The clock starts at the time that the sexual assault occurs. Oral swabs may be collected for up to 1 day or 24 hours. Anal swabs and skin samples may be collected for up to 3 days or 72 hours. Internal vaginal swabs and external vulval swabs for 12 days, and there is no time limit with respect to the collection of clothing items, as deposits on these items may be retained for a lengthy period of time. 2 swabs are collected simultaneously from the mouth, vaginal, and anal orifices, as well as the external genitalia. The second swab is preserved in the event that body fluid testing to confirm the presence of semen is required, or there is a request for independent defense testing. A single swab is used for the skin, such as the breast, neck, or arm. There is a desire to concentrate potentially limiting DNA material from saliva or skin cells onto a single swab, and no body fluid testing is typically performed on skin swabs to identify the presence of saliva. The hospital paperwork bundle is contained within an envelope at the top of the kit. This envelope contains a hospital instruction booklet, 2 consent forms, one for the collection of the kit and a second for the release of the kit to police, the forensic evidence forms, physical examination forms, and guidelines for medical and health care. The amount of paperwork contained within this bundle is significant, and care should be taken to organize it in advance. The paperwork bundle includes guidelines for medical and health care, as well as a hospital instructions booklet. The guidelines for medical and health care includes information around emotional support, relevant medical history, assessment of injuries, and prophylaxis for pregnancy and STIs. The hospital instructions booklet contains detailed information with respect to the collection of the sexual assault evidence kit. Always attend to urgent medical needs before proceeding with forensic examination. The booklet contains information surrounding the documentation, the release of the kit to police, the use of the core and auxiliary pack, and questions surrounding continuity. There is step-by-step instructions for the collection of the kit. The hospital instructions booklet should be kept close by and referred to when collecting each step of the kit. Reassure the patient that this is a normal and routine part of the process. The kit is very large and the collection complex. Referring to these notes as you're going through each step is normal. There are 2 consent forms that need to be signed. One is a consent for the sexual assault kit collection, and the second is consenting to releasing the kit to police. No consent means that no kit can be collected. In cases of drug-facilitated sexual assault, the examiner must use clinical judgment on the patient's ability to consent to the collection of a sexual assault evidence kit. Please note that toxicology levels are not required to determine the patient's ability to consent. For each of the consent forms, the statement should be read out loud to the patient so that they can hear and understand what they are consenting to. Here we have the statement that is read out to the patient for the collection of the kit, and it details that it will include a physical examination, including the mouth, genitals, anus, and rectum. It includes information about their willingness or ability to consent to any or all of the above, and that refusal to consent to any parts of this will not deny them medical treatment. They can withdraw their consent at any time. The consent to release the sexual assault evidence kit to the police must also be completed if the kit is to be turned over to police. Once again, the statement within this consent form should be read aloud to the patient. They need to understand that they are consenting to the release of this kit to the police and that it may be used at trial. The completion of this consent form can take place after the collection of the kit or at another time if the patient is undecided at this time. The forensic evidence and physical examination forms need to be collated prior to use. There is a series of forms that should be put in order, and these forms contain 3 copies. There is a white copy, a blue copy, and a yellow copy. It is important that one form be placed on the clipboard at a time and firm pressure applied with a pen. You'll want to check to ensure that all material written on the form is legible on all 3 copies. If it is not, an alternative may be to photocopy. The same applies to the physical examination forms. These should also be collated, and in this instance there are 2 copies, a white copy and a yellow copy. Care should be taken to ensure that firm pressure is applied and that notes made on the top copy is visible on the yellow copy as well. In summary, the forms contained within the hospital paperwork package should be organized and collated in advance and include the physical evidence forms, the forensic evidence forms, 2 consent forms, one for the collection of the kit and one for release to police, a detailed hospital instruction booklet which should be kept at hand and referred to as needed throughout the course of the examination, and guidelines for health and medical care. The individuals portrayed in these videos are not victims of sexual assault. They have agreed to have their images used for demonstration purposes. The case scenario used for this demonstration is fictitious and is not based on actual events. A 39-year-old female presents for care after experiencing a sexual assault occurring last night. She recalls a brief struggle with an unknown male and reports awakening on a sandy beach, only wearing her underwear that she noted were on inside out. She reports a hickey to her left neck as well as a wet substance on her right inner arm. She reports pain to her lower back, vaginal, and anal area. She last recalls having a drink with a male acquaintance at her friend's cottage. The first page of the forensic evidence form requires the kit number to be included. Every subsequent page, the kit number should also be included in the upper left-hand corner. Here we have patient information that should be filled out, as well as admission information. In this instance, we will circle that the police did not accompany the patient to the hospital. It is required that some details be provided with respect to the nature of the sexual assault. The date and time of the assault should be included, the location, where it occurred, in this case it was outdoors, possibly on a beach. The number of assailants here is unknown. Therefore, the relationship to the patient is also unknown. However, she last recalls spending time with an acquaintance. Therefore, a possible acquaintance may be one of the assailants. Did the patient scratch the assailant within the last 72 hours? It's unknown in this case. Are there other injuries to the assailant that were caused by the patient? Once again, the answer here is unknown. The bottom of page 1 asks some questions with respect to the patient. Did the patient have any bleeding injuries from the assault, including oral, vaginal, anal bleeding injuries? The answer here is no. This may need to be completed after the examination is conducted. Was pressure applied to the neck of the patient? Unknown. Between the assault and evidence collection, did the patient shower or bathe? The answer here is no. At the time of the assault, was the patient menstruating? No. At the time of the examination, was the patient menstruating? No. The top of page 2 of the forensic evidence form asks questions with respect to condom or lubricant use. Was a condom used during the assault? In this case, the answer is unknown. Was a lubricant used during the assault? Once again, unknown. There's a question that asks about the location or locations of ejaculation. Did ejaculation of semen occur during the assault? If yes, specify below. Here the answer is unknown. Ejaculation of semen by the assailants remains unknown. There's no indication with respect to the mouth, vagina, or anus. Ejaculation of semen by the patient is not applicable. As we see in this case scenario, the patient is unable to recall many of the events, and as such, the answer to many of these questions is unknown. This means that several items of evidence will be collected by default. Collect the steps in order whenever possible. The pacing and order of steps may need to be adjusted in order to respect the needs of the patient. Only collect relevant samples and use discretion. Step 1. Clothing and drop sheet. The paperwork asks about clothing that was worn during or immediately after the sexual assault, and there's room to itemize up to 8 pieces of clothing. The underwear should always be collected when available and possible to do so. If the underwear worn at the time of was not available or underwear was not worn, the clothing worn on the lower half, such as leggings, pants, or skirt, may be collected. Other outer clothing may also be collected when there's the possibility of bodily fluid transfer. This may include examples such as external ejaculation, the transfer of blood or saliva onto clothing items. Paper bags can be found loose within the kit. If additional paper bags are required for additional items of clothing, they can be found within the auxiliary pack. The Step 1 envelope itself contains 2 drop sheets. One drop sheet is fully opened and placed on the floor. This is to protect the upper drop sheet from contamination. The second drop sheet, again, is fully opened and placed on top of the first. The patient will stand on top of the upper drop sheet and remove clothing. And when handling bags, this should be done with care to avoid touching the inner surfaces. Items can then be placed into separate brown paper bags over the drop sheet, once again to collect and retain any trace material. The bag can then be folded over and sealed using the white stickers provided with the kit. An item description should be added to the label. Here is 1-1 pink gray underwear, and initials applied to the label as well. This can then be adhered to the brown paper bag. Please note that you would not write on the seals or the bag on top of the drop sheet, and that this is for demonstration purposes only. The upper drop sheet is then folded to be preserved in the Step 1 envelope. This should be folded in such a manner as to preserve any trace material or debris that is contained within it, and such that the paper would fit inside this envelope provided. Once folding is complete, the upper drop sheet can be placed inside the Step 1 envelope, and the envelope can be sealed using the self-adhesive tab. The paperwork can then be completed at this time by answering a series of questions. In this case, there is clothing that was collected with the sexual assault evidence kit. The clothes have not been washed or damaged, and it is unknown whether or not there's expected transfer of bodily fluids. The second portion of the paperwork can then also be completed, which details the underwear, gray-pink underwear item 1-1, placed into the bag 1-1. These were worn before, during, and immediately after, as well as to the hospital, and the drop sheet in this case has also been collected 1-9. The 1-9 label can be applied to the outside of the Step 1 envelope. Notes can be included on page 7 of the forms, any additional information of forensic relevance. Here, the underwear were on inside out after a lapse in memory occurred, and the incident occurred on a sandy beach. Additional clothing items, if collected, can be placed in their own individual brown paper bags, and there is also a large breathable evidence bag or drying pouch that can be used to hold the evidence bags or one large bulky item. It's important to note that clothing items collected will not be returned to the patient. It's a good idea to have spare clothing items on hand for the patient to wear home. Visible stains on clothing not readily collected may be swabbed. An example where this may be considered may be a winter jacket. Step 2, oral samples. The collection of oral samples should happen when there is indications of contact with the patient's mouth. In particular, if there's penile penetration of the mouth, and this has taken place within 24 hours. Swabs and swab boxes are found within an envelope that is labeled Steps 2, 4, 7, 8, and 9. This contains all of the swabs required for the collection of multiple steps within the kit. Swabs and swab boxes contained within this envelope are for use with each of these steps. The swabs may come individually packaged or packaged in sets of 2 and are sterile, DNA-free. The swab boxes themselves come flat packed and must be prepared in advance. Preparing the swab boxes should take place by putting pressure on the outside and not placing fingers into the boxes to help pop them up. This is to avoid contaminating the inside surfaces of these boxes. It is best practice to prepare the swab boxes in advance so that the swabs, as they are collected, can be put into a safe and secure place. 2 swabs are collected simultaneously. This is done by rubbing the swabs along the teeth and gum lines. These are areas where semen may be trapped in the mouth, much like the same areas or locations where food may be expected to be caught or trapped. Once the swabs have been collected, they should be placed into separate swab boxes, 1 swab per box. The swab boxes will allow the swabs to dry over time. The ends of the swab boxes should be closed to prevent the swabs from falling out before continuing with the next step. And labels should also be applied at this time to ensure the continuity of this evidence that's been collected. In this case, 2-1 oral swab and 2-2 oral swab. Initials should also be added to these labels. The ends of the swab boxes can be sealed using white stickers that have been provided. These stickers should be placed over each of the ends to ensure they are secure. The paperwork can then be completed for this section. There's a number of questions that ask details around the nature of the contact with the patient's mouth. In this case, it's largely unknown. We'll circle unknown with respect to contact with the assailant's mouth, finger, penis, anus, other body part, and foreign object. And we'll circle done for each of the oral swabs, 2-1 and 2-2, and include the time collected. Step 3, fingernail samples. Items for the collection of the fingernail samples are found in the auxiliary pack Step 3 envelope. Fingernail samples should be collected if all of the following apply. Scratching or a struggle has been reported, the kit's collected within 72 hours or 3 days, and the patient did not shower between the event and the collection of the kit. The hand is placed over the collection sheet that's provided with Step 3. And a mini swab is used, moistened with sterile water, to sample from the underside of the fingernails. The fingernails are swabbed separately for each hand, 3-1 for the left hand and 3-2 for the right hand. And the swabs is taken from the undersides of each fingernail. The collection paper is used to collect and enclose any debris that is loosened during this process, and care should be taken to avoid disturbing the loose debris or transferring it to the fingers. Alternatively, the fingernails can be clipped using a sterile pair of scissors, and a separate pair should be used for each hand. The mini swab is placed back into the collection tube and retained. The paper is then folded to contain the loose debris or fingernail clippings. Once the paper has been folded, it can be placed into the envelope. And if swabs have been collected, the swab should also be placed inside that same envelope. The envelope is then sealed using the self-adhesive. And the sexual assault evidence kit label can be applied to the envelope at this time. In this case, 3-1. Left hand fingernail samples, and initials can be added to that label in the top right. The paperwork can then be completed by circling Done for each of 3-1 and 3-2 and adding the time of collection. Step 4. Skin samples. The collection of skin swabs should take place anytime there is suspected transfer of body fluids to skin. They should be collected if the events have taken place within 72 hours or 3 days, and the patient did not shower. There is an exception here for biting. If there are bite marks, they can be collected regardless of shower. They are collected if there is suspected transfer of body fluids to the skin through actions such as licking, kissing, and biting. Breast swabs should also be collected anytime there is suspected or unknown contact with the breasts. Swabs should be moistened with sterile water. This can be achieved by pouring sterile water into a medicine cup and subsequently dipping the swabs into the cup. Moistening of the swabs helps to facilitate the transfer of any dry DNA deposits, such as dried saliva, from the skin onto the swab surface. In the case of skin swabs, one swab is used for each site. Here we have a sample collected from the left neck, and the technique used is one of rolling the swab using firm pressure. This ensures good contact with all surfaces of the swab and the skin to maximize transfer of cellular material and DNA. The technique is again shown on the arm. Where there is suspected contact or unknown contact with the breasts, breast swabs should also be collected. One swab should be used for each breast, and a focus of the swabbing area should be on the nipple and areola. Each of these swabs should be placed into individual swab boxes and labeled accordingly. The paperwork should then be completed. In this case, addressing questions with respect to the nature of contact between the patient and the assailant. Here, the patient does not have any recollection of the nature of contact, however, indicates that there was a hickey on the neck and a wet substance on her arm. As a result, there are 4 swabs collected. 4-1 is from the left neck with respect to the hickey. 4-2 is from the right forearm as a result of a wet substance. 4-3 and 4-4 are breast swabs as the patient does not recall the events. Step 5, blood sample. Items for the collection of the blood sample are found in the core kit in the Step 5 envelope. An extra blood collection envelope is also found within the auxiliary pack. A series of questions should be asked with respect to the use of drugs and alcohol. Blood should be collected if the kit is done within 3 days of the incident, and there is relevant history to support its collection. This would be suspicion of impairment that may be related to drug and/or alcohol use. The Step 5 envelope includes a number of items used in the collection of the blood sample. A foam holder contains the sample tube, and 2 bags are also provided which were ultimately going to contain the samples. The smaller bag is labeled Blood 5-1. Draw 1 tube of blood using the gray top tube provided. Place into the protective foam holder and place that inside of the blood bag 5-1. This blood bag can then be sealed and placed inside the fridge transport bag. Please note that the fridge transport bag will also be used to contain urine that's collected in a later step. As such, this bag should not be sealed until step 11 is complete. Patient's name can then be added to the outside label. The paperwork can then be completed. There's a question that asks, did the patient experience any cognitive and/or physical impairment around at the time of the assault that may be attributable to the ingestion or administration of drugs and/or alcohol? If the answer to this question is yes, a blood sample should be collected. It asks that you describe any cognitive and/or physical impairment experienced. In this case, there was a loss of memory. Going to circle the blood sample was done and include the time of collection. The next series of questions relate to previous drug and alcohol use. Within 24 hours prior to the assault, was there any use by the patient of prescription, over-the-counter, and/or recreational drugs? In this case, there are none. Within 24 hours prior to the assault, was there any use by the patient of alcohol? In this case, yes, 1 beer. After the assault, but prior to the sample collection, was there any use by the patient of prescription, over-the-counter, and/or recreational drugs? In this case, there are none. After the assault, prior to sample collection, was there any use by the patient of alcohol? Answer being no. After the assault, but prior to the sample collection, was there any drugs administered in hospital? And here the answer again is no in this case. Step 6, pubic hair and foreign material. Items for the collection of 6-2 are found within the core kit. Item 6-2, pubic hair combing. This should always be collected whenever pubic hair is present. The 6-2 envelope contains a collection sheet, a comb, and a self-sealing envelope. When pubic hair combings are to be collected, the collection sheet is placed under the patient's bottom. This will permit any loose hairs or debris to fall onto the collection sheet for preservation. The comb is then used to comb the pubic hair and collecting them onto the collection sheet. The comb should then be placed onto the collection sheet and the paper folded to enclose both the comb and any loose hairs or debris that may have been collected. The paper is folded such that it will easily fit into the collection envelope. Once placed into the envelope should be sealed using the self-adhesive tab. This same process will be followed for each of the other items that are collected in a similar manner in Step 6, such as the pubic hair clippings. Item label 6-2 can be affixed to the envelope and initials added. Items 6-1, 6-3, and 6-4 are found in the auxiliary pack, and these are to be collected up to 72 hours or 3 days if the patient did not shower. Step 6-4 is foreign material to freeze. This envelope contains 1 specimen jar and 1 freezer transport bag. Items collected in this specimen jar may include a used condom or post-void toilet tissue. In this case, we are collecting the post-void tissue. This is placed into the jar using clean gloves. Gloves should be changed at this stage before sealing the jar and placing the jar into the freezer transport bag. Do not seal the freezer transport bag until Step 9 is complete, as additional items may need to be added. Once Step 9 is complete, this bag can be sealed and placed into the freezer. The patient's name should be added to the bag, as well as a numbered kit sticker. Item 6-5 is found within the auxiliary pack, and this is for the collection of tampons, sanitary napkins, or diapers. These items should be collected up to 12 days, regardless of whether the patient has showered or bathed. The paperwork can then be completed. Here we'll circle none found for deposits in pubic hair. The combings of pubic hair were collected, so we'll circle done. 6-3, foreign material, none found. 6-4, foreign material requiring freezing. Here we circle done and we make a note with respect to the location and description. post-void toilet tissue. The urine sample in this case was collected prior to the genital examination, and the patient was unable to recall events. 6-5, none found. Step 7, externa genitalia samples. The paperwork for the collection of the externa genitalia samples details the nature of contact between the patient and the assailant or assailants. For patients with a vagina and vulva, these samples can be collected for up to 12 days, dependent on the specific case history. In the case of penile penetration of the vagina, up to 12 days, and of the anus, up to 3 days. If cunnilingus has been alleged, the samples can be collected for up to 3 days or 72 hours if the patient has not showered. If there is digital penetration alleged, samples of the externa genitalia may be collected up to 7 days if there's digital penetration of the vagina, and up to 3 days if there is digital penetration of the anus. 2 swabs should be moistened with sterile water. The same rolling technique that is used on other skin samples is used on the externa genitalia, and the entire externa genitalia area should be included in the sampling. The swabs are placed into sterile swab boxes, labeled and sealed appropriately to be added to the kit. For patients with a penis or scrotum, these samples can be collected for up to 3 days or 72 hours. Use 2 swabs moistened with sterile water to collect material from the exterior surface of the penis, regardless of condom use. For uncircumcised individuals, retract the foreskin and roll the swabs around the internal foreskin and the remaining areas of the penis. The same 2 swabs should also be used to swab the scrotum, focusing on the area in closest proximity to the penis. If staining is present, for example lipstick or blood-like staining on the penis and/or scrotum, use an additional separate swab moistened with sterile water for the collection of this material. The paperwork for Step 7 can then be completed. This involves circling any known contact between the patient and the assailant. In this case, it's largely unknown with respect to the vagina and the anus, and is not applicable for penis. We then circle Done, indicating that swabs were collected for 7-1 and 7-2. Trans patient considerations. Neovagina. Consider moistening swabs with sterile water, similar to an externa genitalia sample. Prosthetics. There is no need to collect this type of item. It can be sampled using swabs moistened with sterile water, similar to an externa genitalia swab. Step 8, vaginal samples. The paperwork for the collection of vaginal samples asks a series of questions with respect to the nature of contact between the patient and the assailant. The answers to these questions will guide the samples collected. For penile penetration, samples may be collected for up to 12 days, and for digital penetration for up to 7 days. The 7-day window is in the event that body fluids such as semen or saliva are transferred by the hand or fingers. This diagram is a pictorial representation of the vagina with the speculum inserted. We can see the cervix, and below the cervix, the fornix. A speculum should always be used where possible, but should not be lubricated. The speculum can be warmed with warm water or a gloved hand. The use of a speculum allows better visualization of any injuries that may be present. 2 swabs should be collected simultaneously of the vaginal fornix, not the cervix. The area should be thoroughly swabbed. The swabs are then placed into individual swab boxes, sealed and labeled appropriately. The paperwork can then be completed. In this case, the nature of the contact with the patient's vagina is largely unknown, and as such, unknown will be circled for each of the different locations of the assailant's body. We can then circle Done for each of the vaginal swabs 8-1 and 8-2 and note the time collected. All vaginal samples should be collected with the use of a speculum when proficiency is available and the adult patient is able to tolerate. A speculum should not be used for adolescent patients. In cases where it is not possible to use a speculum, swabs can still be collected by the examiner by inserting them into the vaginal opening, aiming for the vaginal fornix area. Patient self-swabbing is also an option, but it is not preferred. If a speculum is not used, it must be noted on page 7 of the forensic evidence form under any additional information of forensic relevance please specify, and include the method of collection here, examiner or self-swab. Step 9, anal canal samples. The paperwork for the anal canal samples asks a series of questions that details the nature of contact between the patient's anus and the assailant. If penile penetration or digital penetration has been reported, the swab should be collected within 3 days or 72 hours. The external anal area should be cleansed in advance of sampling with sterile water. This can be achieved using sterile gauze. 2 swabs should be collected simultaneously and inserted into the anal canal. The swabs can then be placed in labeled swab boxes and sealed. The paperwork can then be completed. In this case, the nature of contact between the patient's anus and the assailant is largely unknown. As such, we will circle unknown for each of the answers to these questions. We can then circle done for each of 9-1 and 9-2, the anal swabs, and include the time collected. Step 10, DNA reference sample. This step should always be collected, and the patient should rinse their mouth with sterile water in advance of sampling. The foam-tipped applicator is rubbed on the inside of both cheeks. This is done to collect buccal cells or cheek cells onto the applicator. This sample will be used as a known sample of the individual's DNA. The foam-tipped applicator is then pressed into the circle on the pink FTA card. Both sides should be pressed firmly onto the card. Once this has been done, a whitish color change can be seen on the pink FTA card. The card can then be placed into the self-sealing bag. The desiccant pouch provided should also be added to this bag, as it aids in the drying of the sample on the FTA card. The pouch can then be sealed. Label 10-1 should be added to the sample and initialed. The paperwork for this section can then be completed by circling done and including the time of collection. Step 11, urine sample. Note, if collecting urine, ensure the questions in Step 5 of the paperwork have already been answered, even if a blood sample has not been collected. Urine samples should be collected if the kit is done within 7 days and there is relevant history such as suspicion of impairment that may be related to drug and/or alcohol use. The Step 11 envelope includes a jar with preservative as well as a urine bag. Note that the urine should initially be collected into a separate sterile specimen jar. Pour at least 20 ml of urine into the jar provided with white powdered preservative. The closed jar may then be placed into the urine bag 5-2 and the bag sealed. The label should then be completed. This urine bag may then be placed into the fridge transport bag along with the blood sample 5-1 and the fridge transport bag sealed. And a patient's name added to the outside. The paperwork for step 11 can then be completed. Here circling done for 5-2 urine sample and including the time of collection. Physical examination form. The sexual assault kit number found in the upper right-hand corner of the kit should be included on each page of the physical examination forms. A ruler can be used to measure the size of any marks or areas of redness noted. The physical examination form is used to mark all injuries relevant to the assault, as well as areas of tenderness or pain. The plex mnemonic is used elsewhere in the training and refers to the following: pain, location, unique features, color, kind of injury, and size. This tool can be used to assist in completing the physical examination forms. Describe the color, appearance, and size of injuries on the diagrams provided. If you're using the exact words of the patient, use quotation marks. Here we have an area on the left neck that is approximately 4 by 3 centimeters and is purple in color. The word hickey is placed in quotation marks as this is the exact word used by the patient. Page 8 of the forensic evidence form asks a series of questions relating to sexual activity that is not related to the assault. There is a paragraph that the nurse should read to the patient. It is recognized that the following questions include personal and private information. The purpose of these questions is to determine if DNA from a person other than you and the assailants may be present on or within your body. Your answers will assist the forensic scientists with their analysis. The series of questions should be asked based on what samples have been collected, and this page can be completed at the very end of the examinations. Ask each of the following questions if the related swab was collected, regardless of the description of the assault. Page 9 of the forensic evidence form contains continuity information that needs to be completed and includes information about the nurse examiner or physician completing the kit, as well as the date and time that the kit was sealed. Keep in mind the chain of custody of the evidence. One must not leave an open kit unattended by persons that are not involved in the completion of the kit. It should be placed into a locked cabinet with restricted access, or ideally, handed off or signed for by law enforcement. The bottom portion of page 9 should be completed when the kit is turned over to police. This requires the officer's name and signature. Once all examinations and paperwork are complete, the evidence should be placed back inside of the core kit box. All evidence should be placed back into the box, ensuring that it is properly sealed and labeled. This includes any underwear or other clothing, swab boxes, and envelopes. The blue copies of the forensic evidence form will need to be separated and collated to also be included inside of the box. There are 2 additional seals provided with the kit. One should be placed back into the box for future use, and the other seal used to seal the outside of the core kit box. Once the seal has been applied to the outside of the box, it should be initialed. There are 3 different types of storage that may be required for a complete kit. The core kit itself can be stored at room temperature. The fridge transport bag should be placed into a refrigerator to keep the blood and urine cold, and anything that requires freezing should be placed inside the freezer transport bag and stored accordingly. The Provincial Sexual Assault and Domestic Violence Navigation Line is available to assist you in collecting a sexual assault evidence kit. Please call 1-855-628-7238. This work is a collaborative project between the Ontario Network of Sexual Assault Domestic Violence Treatment Centres and Ontario's Centre of Forensic Sciences. Animated slide templates by PowerPointSchool.com. Music is a song called Tenderness by bensound.com.